wow, matter of fact, I got a lot of really interesting comment from many people from all the world. And there was a lot of them is giving me tremendous amount of encouragement. You know why? They would say, hey, you have been helping me alert, like, for example, a breast cancer lectures. After that, within like 4 or 5 days, I right away got some very good feedback from people from United States. Some customer was telling me that the viewer is say, hey, because you alerted me and I found a lump. And you know what? I went to see the doctor right away. And then the doctor said, wow, you are actually now you have to go a biopsy and so forth within a couple of weeks to come back and say you're stage 1 cancer. So they really appreciate just because I alert her to check and she was able to get that checked, and then she was now being very healthy because of the fact that now she's stage 1 cancer. Immediately go get more help to ensure she didn't get worse down the road. So that's why I think that what we have done here is not to just to get you to have some understanding what's happening, but importantly to give you idea though you need to check. So that's why now we'll move on. The next subject is liver cancer. Now, a lot of people don't aware, wow, if I'm diabetic, would I really easily get liver cancer? Yes, there's a higher risk, okay? Diabetic doesn't cause liver cancer, but it gives you the environment, the condition to develop liver cancer. And then that is the important concept you understand, is kind of give you the environment to lead you more chances potential liver cancer. So today, that is our seminar. I hope that you enjoyed it, to at least alert yourself, get some idea, and hopefully that with that, you can now start taking action. The importantly is take action and not just stay there and say, wow, okay, I will take my time. Wow, that's not good, because cancer cannot take the time. You have to take active participation to make sure that you really go out and start doing action to make sure that you are start getting treatment or getting diagnosis to confirm whether you have cancer or not cancer. So today we're going to explore the link between diabetic liver cancer, and that's what our subject. So today is going to be a very good topic to better let you understand how diabetic to kind of link to your cancer, to liver cancer specifically. So today we'll do somewhat introduction, understand what is diabetes, what is liver cancer, and understand what is the link and how they impact the link, and then how you can able to have early diagnosis and some lifestyle modification to prevent this can occur. So actually you can able to provide you this lifestyle change, give you less chance to get cancer. And then what is the prognosis with what you're doing and how Luxury can help you. So today is going to be a very full of information which can help you to basically watch potential your risk of cancer, and also help you to understand what's diabetic linked to it. Okay, so today that's what we'll do. Okay, let's start. So let's understand diabetes first. Now, a lot of people really at the end of the day, I notice a lot of people don't really have a lot of understanding what is diabetes, how it works, and so forth. And diabetic is very simple. Basically, all go through 4 stages, as you know, all go through 4 stages. The first stage is the LDL cholesterol goes up, it damages your B cells, and when it damages the B cells, pancreas, all the B cells comes in, B cells will take the sugar to the cell, it doesn't work, so blood sugar goes up. Now problems start occurring. LDL cholesterol goes up, blood becomes thick, and when blood becomes thick, then you will have all the plaques start forming all over the place, the entire body. So including your brain, your head, and start moving very quickly to stage 2, because now they form plaques like this everywhere, the entire vessels. And so eventually, when plugged enough, your blood pressure start increasing. When blood pressure start increasing, you will not feel anything. You continue not to change your lifestyle. you very quickly move to stage 3, which is called pre-diabetic, meaning your blood sugar can go up, and all doctors measure the same thing, which is your hemoglobin A1C, hemoglobin A1C, HbA1c. They measure the amount of sugar, percentage sugar attached to your hemoglobin cells. And so if you have 5.7%, you are a perfect person. If you have more than 5.7% to 6.4, now you become pre-diabetic. Unfortunately, a pre-diabetic person has no medication to take. Basically, the doctor would just say, hey, you're pre-diabetic. Now you have to really change your lifestyle, improve your exercise, your food you eat. But unfortunately, this is not motivating enough. So majority of people don't understand. So really, low sugar tea can definitely help you. You just drink tea to help you to 3 high, meaning lower your blood sugar, your cholesterol, LDL cholesterol, and your blood pressure. Now, if you don't do anything, unfortunately, very quickly, you will change yourself to stage 4, which is your diabetes. Once your HbA1c was 6.4% above, all the way to 7 and up, the doctor will basically give you medication. You are diabetic forever. Now, once you become diabetic, you cannot come back, okay? So keep that in mind. I don't want you to go on that stage. If you can, stay on, non-diabetic, stay on before you even go to pre-diabetic. When you are already cholesterol going up, blood pressure, you got to start working on it. So that is our objective here. Limit, decrease your 3 high to a normal level, your less risk to become a pre-diabetic or diabetes. Now, I'll come, why we just to ask you to do low sugar tea. Now, low sugar tea, because it's guava leaf, which has, 2 things. That guava leaf is a bitter melon, and guava leaf will help you delay the absorption of sugar into your bloodstream. And then your bitter melon increased insulin sensitivity will take sugar into the cell, and also take cholesterol, LDL cholesterol, and sodium out through urine. Also, sugar go out urine. Result, your blood sugar will go down, cholesterol go down, and blood pressure go down. Plus, you will detox. Isn't that wonderful? So, this is that's why we would suggest you to drink low sugar tea. Now, our company don't want to just drink the tea. We also want you to really give you 5 programs to help you to manage your 3 high and also manage your pre-diabetic diabetes. And I have helped many people lower the A1C from 10+% all the way to 5.7, normal person range, okay? So we help you to learn about proper healthy diet with low carb, low fat. We ask you to exercise 8 to 10,000 steps per day with weight control, BMI less than equal to 23. We'll get you doctor webinar of every week and free of charge, so you can able to understand what's going on. Plus, we have a daily blood tracking system. It's very easy to do. You can understand your weight, your cholesterol, not cholesterol, your blood sugar level, what you eat, and how you exercise. And in 1 week, you can tally it and you can see it every week. So it's really easy to do and it's good for you. So anyway, that is what we do. And so hope that you can actually have that. You have a system to manage your health. And that's why we said we're holding your hand throughout your diabetic journey. With that, hopefully that you will not become any kind of pre-diabetic or decrease the diabetes risk, and we will be healthy and enjoy your grandchildren long time to go. So now let's understand what is liver cancer. Now, a lot of people don't realize liver cancer actually really start off with liver cells. The most common liver cancer is really called hepatocellular carcinoma, which begin with mainly the liver cell called hepatocyte. Now, other type of liver cancer could be more complicated, which is less common. We're not going to mention all the names because it's kind of complicated, but more important to realize, a lot of cancer in liver is due to metastasize, which is spread from other area. That is the part which is really thing that you really have to understand. A lot of time people will have colon cancer, lung cancer, is spread to liver. Then you become really a bigger piece of the problem now, because now you have not only one organ involved, now you have multi-organ, including your liver, which is very important. So if the metastasized cancer is named after organ, it's called metastatic colon cancer or wherever it come from. So it's spread to the liver. So you come up with a name attached to where it spread from. So typical cancer is for liver is hepatic cellular carcinoma. However, the more common also is cancer spread from other organ because you have colon cancer now spread to liver. So now a lot of that will happen. So keep in mind, it's not only from one area, also from other organ, it'll get in the liver, and it's very common. Now, really, the cancer percentage of, really is a big killer. Yes, over 830,000 deaths annually. And seven people most cancer is in women, and fifth in men are this liver cancer. Now, certainly, 80%, 80% of typical liver cancer have hepatic cellular carcinoma, we call HCC. HCC are the type of liver cancer. And every year, there are about 900,000 new cases. So it's a big number, okay? So what is the risk to get this liver cancer? Certainly, now, there are more liver cancer in men than women. Now, you have type 2 diabetic and sometimes typical rare disease that also have a lot of liver cancer. So the lifestyle factors, such as you're not very healthy, you always eat very fatty food, you eat a lot of processed meats, don't eat much fruits, vegetable, you are not a, you're a person that you just watch TV, you're obese, you're smoking, you drink a lot of alcohol, a lot of whiskey. All this will get you more risk to get liver cancer. Plus, there's also hepatitis B or C. Now, a lot of people don't realize if you get hepatitis, you actually cause the cancer, cause the liver to be scarring, cirrhosis of the liver. So all those areas can potentially get you common to cause cancer in many parts of the world. So hepatitis A, hepatitis B, or hepatitis C, all that will be potentially get you into potential some kind of liver cancer if you have it. Not everyone have it, but there's higher risk if you have that. So that's why a lot of people say, wow, if I have hepatitis B, I better watch, because especially Orient has a lot of people with hepatitis B. So that is something you have to watch. Now, what is a symptom of liver cancer? Now, majority of them in the early stage liver cancer, you don't have much symptom, by the way. Sometimes you will have got, when you get down to really get up a little deeper range, you start getting jaundice. You have yellow skin eyes. So a lot of people thought, wow, my eyes become yellow. So does it mean, I have a gallbladder issue? So you better go check, because it might not be gallbladder. It could be also liver cancer. Plus, your stool become kind of weird, become chalky white. Okay, it's a white stool. It's no longer brown. Your stool is regular brown. You start losing appetite. You don't want to eat. You're gonna have a pain on the right shoulder up here, because it's not kind of funny. Pain. You also usually have ascites. What is the stomach start getting bigger, and abdomen's got built up. It's not mean you're fat, but you have build up this gigantic stomach coming in. He's got to get abdominal pain. You get fatigue. You got to get tired. You got weak, and then you kind of explain why sometimes weight loss. Loss you talk about. You lost big time. Means 3-5 kg per month. Okay, so you lost few kg. You didn't do much exercise. You don't eat, and just keep losing weight. So these are the kind of symptoms. Once you get any of these symptoms, you got to actually get doctor to check your whole body. See, is it may not be understand, is it right away understand liver cancer, but you have to check right away how come it become like that. Now, how diabetes linked to get a liver cancer then? Because this is somewhat really what related with diabetes to liver cancer. Why have that? Okay. Now, one of the things that is very interesting, First of all, you have non-alcohol fatty liver disease. Now, certainly, as you know, some people that because you drink a lot of liquor and you can potentially end up with fatty liver disease. Now, but on the hand, there's such a thing, you don't drink any liquor, but you now get a fatty liver. The reason is because of the fact that your insulin keep coming up and it doesn't work. So the type 2 diabetes are continue to get more fat storage in the liver. And so now you contribute a called non-alcohol fatty liver disease, which is NAFLD, okay, which is simply the fatty liver from non-alcohol. Now, another one is also your fatty liver, no alcohol. It's also one more thing is called NASH, which is talking about your NASH is character liver start inflaming and will start damaging liver cells. And when it damages the liver cells, the liver start getting fibrosis, meaning fibers, because you keep, getting injured liver. So the fibers, the liver become like fibers, like, once you, a scar, if you will, okay? So ultimately, all that lead to called cirrhosis of the liver. As when you get cirrhosis of the liver, that's why it's really you're getting your higher risk to get HCC tremendously, meaning that you get liver cancer if you HCC, and that is something that you have to concern because that will give you potential liver cancer. Give you an environment to create liver cancer when you have cirrhosis of the liver. Now, type 2 diabetes. Another thing is because of the fact that insulin keep going up. I mean, the blood sugar giving up because they continue high insulin resistance, leading that there are more insulin to produce, but the sugar doesn't go in the cells. So net result with that. So that's why there are more sugar and more fats are built in the liver. So it create an environment. Really, all that will create two potential issues for you: NAFLD and also NASH. So that is the link basically. Now, also you have oxidative stress of inflammation. As you know, when you have diabetes, your blood sugar continue goes up. When your blood sugar level continue to go up, you also generate a lot of harmful free radical cells that damage liver cells. So in that result, you have always a chronic inflammation. Now, that's the one problem. We have more chronic inflammation. You trigger more growth of abnormal cells, which ultimately also potential to develop cancer. So you really do not want to give you body a lot of inflammation because all the body become inflamed. You are giving a better chances, if you will, to get cancer to grow, and that is not good. So now, what is the impact at the end of the day? Well, you have now you are a person that, hey, I'm a person is diabetes, so I now could be potential have a little higher risk than the non-diabetic person, because when you're diabetic, you have all kind of mechanism really give you potential a lot more risk than a person non-diabetic. So really, at the end of the day, you need to start knowing that, one, if I'm diabetic, I have a high risk at liver cancer. So you know that. So you have to check, you have to manage, you have to make sure that you have the risk management here. Now, also, if you're a diabetic, you're 2 to 4 times can get hepatic cancer, or liver cancer compared to non-diabetic person. So if you are younger age, you're diabetic, you really need to early keep checking. If you're a younger person, meaning like 40 or 50 years old, now I'm diabetic. So you got to keep checking whether you have potential liver cancer. Okay. And really, at the end of the day, a lot of time, because as young people, you don't seem to say, I don't think I got that, but the chances of getting that is high if you are really diabetic. So, and also you have a long life to live. So you got to really have to check on this potential is important. Now, also studies show that the people who are diabetic, they tend to have less survival rate if you are having liver cancer compared with the people who are not diabetic. Okay, so in other words, if you have diabetes and I got liver cancer, the chance of survival is lessened. Okay, and also because of the fact that you have to treat diabetes, it's already very complicated treatment. Now you have liver, also disease, which is another liver cancer, is also another very high risk treatment issue. Both will cause you tremendous amount of risk of side effect, treatment. Man, that will be a tremendous risk and stress for you. So people who have both disease, they tend to have more higher mortality rate and also tend to have more chance of depression, psychological, for the impact for the family. Really, you need to have a lot more comprehensive support for you, because if you have liver cancer disease, liver cancer, you have diabetes, you know how much work you have to do. You have to probably go chemotherapy. Now the chemotherapy might be affect your diabetes treatment, and you will have all sorts of stuff that you have to see the doctor. You'll be weak. Now you have to check your blood sugar. Wow, it's so complicated. So don't move into that route, because that is really bad for individual. So key is diagnose early and try to get it treated early. That will be the best strategy. And try not to get in diabetes, because the key is control your blood sugar. Well, how do you do that? Now, very early stage. First, you have to have lifestyle modification to prevention. And that's the most important, meaning that I have to do balanced diet. I have to prioritize the type of products I eat, like fruits, vegetable, whole grain. I need to eat lean protein and limit my red meat or any kind of processed food. And I'm not going to drink a lot of sugar tea, like bubble tea, those sugar drink. You have to eliminate that and have to drink low sugar tea. Now, low sugar tea will definitely get drink, using 2 bags, 8 glasses a day, and 2 glasses basically each meal. Now, that is so important, okay? Because you drink 2 glasses before and after the meal. That means that you can able to have 2 glasses at lunch, and 2 glasses breakfast, 2 glasses lunch, 2 glasses dinner, and 1 glass before sleep, and maybe 1 glass in the afternoon or after dinner. So you have 8 glasses to help you to continue lower your blood sugar, cholesterol, and blood pressure, and help you detox. Now, certainly, you are going to go to a lot more restroom, but that's important, because to help you dump off your sugar, your cholesterol, your salt, and then you lower your blood pressure, and get rid of all your poison. So drink a little sugar is really important. Now, you have to also manage the stress. As you know, what stress does is it causes you inflammation. It gives you cortisol come out, then you have more, hormone, adrenaline come out, fight. The whole body become inflamed to just prepare your, stress. Okay, so you really have to think about relaxation technique, yoga, medication, listen to nice music, whatever you do to help you relax. You got to keep doing that. Now you have to generate enough sleep, like 7 to 8 hours per day. Quality sleep is helping you to actually rejuvenate your body. So when you do that good sleep, your blood sugar definitely will come down. You have to have regular exercise. We have to 150-minute regular exercise per week. So you got to basically go, you even say, hey, I can't do a lot of exercise, just walk. Very simple. Walk 1 hour a day. 1 hour, go to shopping mall, walk. And if you have able to get a barbell, go up and down like this, up and down like this, and you can do that, 20 times, a day, and keep doing this. Some weight, 1 pound each side. That's all simple. And you can do it walking. You can do walk, or you can do a step master. And so that way you can able to help you to continue burn up sugar. You're going to help you, because the exercise help you better bowel movement. You got improve everything. Your insulin become more sensitive, so you basically less really become, rather your insulin continue ongoing insensitive. So exercise is so important. At the end of the day, as you get older, you walk better, faster. You won't fall, okay? Easy, because your gait is good. So keep doing that exercise. Don't stop regularly. Now, you also have to minimize your alcohol consumption, meaning that you really don't want to drink a lot of alcohol. Maybe half a glass of wine, 1 glass or 2 glass, perfect. Half a glass, not the full glass, not the whole bottle, okay? And so you need to choose. Maybe you drink low sugar tea instead of alcohol. So you can do all that. You can make icy low sugar tea. It's okay. Now, if you smoke, you got to cut that off, because smoking is developed. You can really smoke can develop liver cancer. You got to quit smoking. And it really helps you for overall health. If you're a smoker, you also not liver cancer. Could be also lung cancer. Wow, you don't want to add another stack on you. Now, if you are overweight, the BMI is 30 and higher, you got to lower down to 23, because with better health, you lower your basic A1C to 1 point, 10% of your weight less. You also decrease the liver cancer risk. So we really, you have to continue prevent you have fatty liver disease, cirrhosis of liver. Those are all came from possible overweight. So with that, if you are less not overweight, the chances of you have fatty liver disease and cirrhosis of liver has become decreased. So keep drinking your low sugar tea. And basically all that, what you do here is help you to focus, lifestyle change, lower your 3 high, you become very healthy. Now, also other protective measure, you have to continue to measure diabetes, make sure your A1C, HbA1c is lower than 6.4%. And that's very important, because if you continue to drive your A1C under 6, the chances for you to get diabetic complications is less. Now, if you have hepatitis B or C, you got to start taking treatment. You cannot let it go to develop liver cancer, because you treat it, you don't have chronic. The problem is you don't have chronic hepatitis B or C. If you have chronic, then you have an issue. The chance of risk of going to liver cancer is very high. And certainly nowadays, the vaccination for hepatitis B, if you don't have get vaccination, you got to protect yourself. Get the vaccination, hepatitis B, to protect you from getting liver cancer, and also prevent you from getting chronic hepatitis B infection, which is eventually cause cirrhosis of the liver. So all that is a typical protective measure you can take. Okay, now but not least, why drinking low sugar? Again, you lower your blood sugar, LDL cholesterol, blood pressure. And combined with all that, you are now lower your 3 high, will support you lower your blood sugar, lower blood pressure, and lower bad cholesterol, which is LDL. And that result, hopefully you become much more healthier and prevent you to get into pre-diabetic and diabetes. Or if you are diabetic, no problem. It drive you down to pre-diabetic stage, and hopefully you can stay there. But that take work continue. So at the end of the day, I want to stress that diabetic, liver disease are very much linked. Diabetes does not cause you to get liver cancer, does not cause you, but it creates environment to help you to get diabetic, can have create an environment for liver can be potential develop your liver cancer. So that is the key point. So although it doesn't direct cause, but it developed the environment for them. So you don't want to create that environment. So keep your blood sugar down, get liver cholesterol down, don't get fatty liver. Also, when you have badly managed diabetes, most likely you're going to have non-alcoholic fatty liver disease. That is also potential lead to liver cancer. So with that, you can decrease the risk if you can properly manage your diabetes. Plus, you can manage a healthy weight, eating balanced diet, good exercise, continue to measure blood sugar, Net result, you never got very high blood sugar. You have no environment for cancer to grow. Then you have a good preventive measure for liver cancer. Therefore, at the end of the day, you got to get a healthy lifestyle. Make sure that you have, importantly, able to lower the 3 high so you achieve a better diabetic management or not even getting diabetes, and also prevention of liver cancer because you are continue to be healthy and you decrease all the other risk factors. So today's lecture, really at the end of the day, is very simple. You can do it. Up to you to go monitor if I can able to continue to manage my blood sugar to be lower than 6.4 A1C. The chances for me to get complication diabetes is lower. Cancer of diabetic complication also lower. The chances for me to get fatty liver disease also lower. The chances for you to also get cancer of the liver is also lower. If you do all that, it will help you to be continually healthy. And I hope that you can able to really act now, don't wait, and take all the initial screening and make sure you continue to check with doctor if you are getting jaundice, pain, ascites, all these things, you got to act. But key is to start now. Get yourself to be healthy, lower your 3 high. If you have a question, write to me, andy@wafong.com, andy@wahfong.com, andy@wahfong.com. Now, you have WhatsApp, you can write at area code 852-3001-5644 or 852-6792-8891. That's my WhatsApp number. So you can always contact us and write to me. A lot of people do, and they really get a lot of good information or further clarify the questions that they might have on the lecture. So thank you for joining me on your busy weekend. I know you all are busy, but importantly to understand how all these link, and you need to act to basically get a healthy lifestyle and you decrease all your risks. Okay, if you have no question, I appreciate all your attention and I'm looking forward to work with you again next week. You take care, enjoy your weekend, and be healthy. Thank you again. Bye-bye.